Yes, initiated.
Yes, sir. Thank you. Veera, sir?
Yes, good evening. Good evening, one to the 241 session of Mental Health Webinar Series. I welcome you all on behalf of Department of Psychology, American College, Madurai, as well our head, Dr. Suresh Kumar, and also Madras School of Social Work, Chennai, Department of Psychology, Madurai University, MS Chalamuthu Institute of Mental Health and Rehabilitation Center, Madurai, Red Bond Education and Psychological Research Center, Madurai, Psycho-Oncological behalf of all the associate partner institution as well the American College and Dr. Suresh and four team member of Mental Health Webinar Series, I welcome our today's speaker. Yes, of course, our head Dr. Suresh Kumar and all the sincere participants. Thank you, and I request Ananya ma'am to propose the intro or today's speaker as well, giving the general instruction to all the participants. Thank you.
Thank you, Veera sir, for welcoming all of us. So I'm really happy here to to give an introduction about our Suresh sir. It's because of whom we are all here in the first place, and he's currently working as a head of the department in American College Madurai, as we all know, and he has presented lots of papers in lots of national and international conferences, and also he has um, done lots of PPTs for all of us, which is actually making us to think beyond, and also serves as a material for all our subjects in general. And I'm thanking you from the bottom of my heart for that wonderful job, sir. A lot of students are actually benefiting. Thank you so much for that. And to introduce Suresh sir, it's kind of difficult because I'm just wandering around with words and I have lots to talk about. So, yes, he has even published papers and published books on his own research studies and other things. He is a altruistic person. That's what his WhatsApp and his Facebook status also says. And he's proving that he's becoming more and more altruistic day by day, and he's helping lots of us gain knowledge, which is the best thing to give somebody. I believe it is going to pass generation to generation. That's what you're doing, sir. Thank you so much for even giving us an opportunity um, for being here. And we have the TNCCA, Tamil Nadu Career Counselor Association, and all the other associations that you are working on. And you're doing your best in everything that you're doing. And you're helping a lot of other people also grow. So, all of us here and from all the core team members, we are really thankful that you are doing whatever you are doing. So I'm really, really happy that you are doing a presentation today, and we are going to for sure gain knowledge from your presentation. The floor is yours, sir. We are waiting for your presentation. Thank you so much.
Yeah, thank you, Ananya and Dr. Veera sir and other core team members. A very good evening to all, and today I'm going to share some bit of knowledge, I can say, the learnings I made it recently. So when I was preparing content for attention, it is for cognitive psychology, and another paper I'm taking there is on general psychology also. And these two papers, when I was preparing, and one article I found that there are diseases or disorders, difficulties, deficiency in attention, and these can be grouped and named into different categories are there. And I'm going to just share the inputs regarding only one component in that, aprosexia. So this word aprosexia, and the word some of you may have the sexual related disease, but no, it is related to that attention deficit. We will look into that. And I found that very few articles were written on the particular topic, and now we are using a different name. We'll look into that. What is the name we are using at present? What will be the real cause for the aprosexia? And where these aprosexia were explored, and who has given the term for a particular problem, attention deficit, and what are the strategies we can adapt as of now? What are the strategies are available to overcome these kind of problem? So these are my outline of my presentation. So this is about, I think they presented, they told me very clearly. Listen, we have to start with the question, what it is. What, why, when, how, that is the question. What is this? Aproxexia is nothing but an abnormal ability. Normal means when you listen somebody, when you attend to somebody, and you will, eye contact will be there, and you will lean forward, and then that means it shows that indication. The non-verbal cues will give an idea about, well, what kind of activity you are doing, you are attending or not. Okay. So abnormal inability. See, normal is something. Abnormal means most of the people will do the particular thing, and some of the people deviate from the normal. That is called abnormal. And second one is inability. And then actually they are not having the ability to sustain that attention. Inability to sustain the attention in abnormal way, that we can call them aproxexia. Okay, that is a term, a meaning for the term. And you can look at that the first. There are two terms are the word itself. When you dissect that, it is an hybrid word, we can say. A means when the word aproxexia is composed of two words. A, suffix is an A, which indicates lack of. Be anything you can add. Apathy, that is not we are having the emotions. So these are the A means lack of. And that the next one is an proxexia, which means when you translate into that, literally that means attention. Proxexia means attention. That was the term long back very frequently used, but nowadays we are using the term attention. In the sense, when you look at that combination of hybrid word of these two words, A, proxexia means a lack of or inability to pay attention. Lack of ability or inability to pay attention to the particular thing. And where we can hear the term generally, it is a kind of attention deficit. I think you are all very clear about it. We are going to talk about attention deficit. Why it is important for mental health professionals or psychologists or behavioral science people. The reason is there are more number of cases where having that attention problem in day-to-day life. Almost all the teachers are complaining. These students are not attentive, and they are not. Even the parents are complaining. They are not attending to the communication, the information I'm sharing with you. So these are the every day we are hearing from different in family setting, in the classroom, in the society. And these attention has a huge role right now. And when the person having that problem in that, he will lose many things, I can say. If you are not attentive, for example, if you are in a selection board or if you are in a classroom, okay, if someone is there, the leader is presenting to you, if you are not listening, if you are not attentive, and you will not be preferred by the person. Even if you ask the person, they will not give up faith. They will not answer your question. But at the same time, a person who are attentive and the person asking, they may give that. It is analog for the classroom as well as family also. Who are attentive, they will get a benefit. They will communicate properly. And next one is here where these studies were done. In 9th century, 19th century, the late 19th century, a doctor named Guy. So he is a professor from the University of Amsterdam. He made a paper. So he prepared a paper, and that paper is named as on the aproxexia, the inability to pay attention and other problems of functions of the brain caused by nasal disorder. This was the paper first he prepared, where he used the term aproxexia. Who is the person who were associated with the University of Amsterdam? He prepared and he presented a paper. There he gave the term aproxexia. Before 19th century only he used, but before him in 1800s, a century before Guy, a doctor like John Jacob Wafer, who also had described the same the problem in that many people who had an experienced intense headaches, tremor will be there like shaking hands, and memory deficit related to nasal obstruction. And if the person who is not able to breathe properly, now we are having breathing exercise and the mindfulness is that mindfulness breathing exercise is also very popular. And when you are not inhaling, I think many of you in that cold winter, when you got a cold, and it is very difficult for you breathing. Just think about that. These inability, the nasal disorder, nasal obstruction will lead for your memory deficit, and it will lead for your other problem like headache and then attention component. And in the year, the same person, in 1882, the doctor named Hack, he suggested that the nasal condition could be studied from the psychiatric point of view. Don't study from the physician point of view. Physician, what will do? They will examine that physical body, and then they will say that there is a block is there in the nasal, obstruction is there in the nasal. But he said that the person having that apoplexia means not showing that adequate attention to that, are not able to pay attention to the particular activity. Don't look into that only abstraction is the reason for that. You just look into that psychiatric point of view also. That is, he's a first person. He insisted look into the psychiatric point of view. And this is the paper, you can see. This is a paper. That the guy who wrote it that in 1889. In 1889, who introduced the term apoplexia, which means specifically the memory deficits. Not only meant for attention deficit, it meant for memory deficit and inability to concentrate for a longer period of time. As I said in the beginning itself, the attention span of human being comes down nowadays because of excessive use of technological inventions, mobile phone, laptop, and other televisions, radio, and other components. When we are using excessive, our attention span comes down the last 10 years, 1 decade. And the goldfish attention span is better than human being. Okay. And these apoplexia were studied in two main target audiences. One is children and another is young students. So these were the two target audience when they were intended to know about further about the particular thing. Yes, the sources of the file will be there at the end of my presentation. I'll show the reference also. And apoplexia, the William Hill, he concluded that the difficulty in breathing. Okay, sometimes there is an obstruction in nasal way. We will have the breathing difficulty. We are not having the adequate oxygen for your brain. Okay, this difficulty of breathing is an underlying problem that responsible for children's intellectual disability. He not named that it is a memory deficit, or attention inability, or disorder, disability in attention. He was not use the term. He said that if the person not having that adequate breathing, there is a problem in that breathing of children. Okay, that leads to children's intellectual disability. I think you all know the ID. ALB named as a mental disorder. So he found that the obstruction also leads to intellectual disability. Intellectual means we cannot perform that day-to-day activities. For example, calculating simple calculations and memorizing simple component and paying attention to the different components. I think see the picture itself we can able to get. Sometimes our brain not having that adequate oxygen, or if it is not having that adequate energy, it will be tired. We feel more fatigue. As you know that our brain is on only 2% of our whole body. If you are whatever may be your weight, if it is on 70 kg, your brain weight will be 1,400 grams, 2%. So 2% of your body, but it takes 20% of the whole energy what you are having. The remaining 80% of energy goes to the 98% of our body. And the person who is the person who introduced, he said that the apoplexia had a physiological character. Physiological character means they feel that the brain fatigue caused because of nasal disorder. The nasal disorder leads because they are not having the adequate oxygen and adequate energy for the brain. That leads to apoplexia. He is the person who given the lead for what may be the cause for that. And there is another person along with Guy, again the second researcher, Hill. But he said it was not in itself nasal obstruction. It's not only the nasal obstruction that are consequent the difficulty to pay attention. There is one more component also. Not, for example, there's an obstruction that will lead to inattention. No, it was rather the nasal obstruction causes children not to sleep well the previous day. When we go to the bed, we are not having that adequate airflow in our nasal area, and the children will not sleep properly. That leads to that is the reason for the person, the children are not performing the next day. They may not show that alertness in the next day classes, and they may not have the full energy. He agreed with that guy that yes, nasal obstruction is the one of the cause for the apoplexia, and these nasal obstruction and not directly related to the difficulty in paying attention. It is because the children who had not better sleep on the previous day because of nasal obstruction, and that leads to poor sleep and insufficient flow of energy in the brain. So that leads to the particular problem. So it is on finding a hill. And but both Hill and Guy were argued that medical treatment nasal obstruction or there are many strategies are there. For example, I know one of my snoring is a biggest hurdle for many of you. I had on one of my friends. We cannot sleep in that room. Not only that room, that area itself. That much louder noise he will make. The snore will be there, and it is because of there is an obstruction in the airflow, and these can be treated through surgeries or the medical treatment we can use, and you can find out some of the instruments we can plug in. There's some plugins are available. You can find it in Google, Amazon, and Flipkart also. These will be effective for overcome that nasal obstruction. It is a remedy for inattention. So they agreed with that. And again, these two researchers, as Hill and Guy, maintain that it is necessary to make an accurate diagnosis. You cannot say that a person who is inattentive and there is an obstruction in them, that is because that you cannot label it an apoplexia. We have to make an very accurate diagnosis about the case. Which a difficulty in breathing at night was causing difficulty to perform different intellectual disability. Whether these obstruction of breathing will lead only to that attention problem or that leads to intellectual disability of the children also. Whether the performance also change in an individual, you have to compare. If it is related to attention and memory component, you can label it. Otherwise, if it is on more complications, it's totally different. So that is the point I told that. And in the year 1892, there is another doctor named Carpenter. And this year also there is one woman who got a Nobel Prize. Her name also Carpenter. And this person in 1892, see how many years back, he related sleeping disorder with nasal obstruction. When there is an obstruction in our nasal air breathing, and definitely the children or even adult, we will have a sleeping disorder. For example, hypotropic rhinitis. So it is a kind of sleeping disorder related to insomnia and nightmares. Related to insomnia means lack of inadequate sleep. Nightmares means the children will scream during the night, and something unusual thoughts will come in their mind, the dreams, and these things this will lead them to difficulty in paying attention and treating the information for when they wake up and they cannot retain the information, what they had, what kind of things they had to process it in their thought. Okay. And here is the person, William Bliss. He has done a study with 130 cases. And he called, he never given the term called apoplexia. He given the term called nasal neurosis. It's the same thing he called nasal neurosis. It is a symptom of insomnia and nightmares. So the others were given that apoplexia, but he, the person, after conducting study with 130 cases, he told that it's not an apoplexia, it is called nasal neurosis. Okay. And so it was finally the Wells who in 1898 is the person Wells who studied with the 10 cases. The people who were suffering of nasal obstruction reported daytime drowsiness. The very next day they feel that they are not feeling energetic, lowered energy, and which was reported to the doctor. And he observed from the 10 cases, and he what he has done, okay, what's the problem? There's an obstruction in the nasal area. When we restore the breathing, if they can breathe properly, in a few weeks, he observed again with the same cases, the 10 cases, he found that they completely recovered from the symptoms such as insomnia, drowsiness, and inability to listen. So these were things where he found that they were recovered from the problem. So nasal obstruction is one leading cause for the sleeping disorder. That sleeping disorder is directly responsible for inattentiveness in the next day. Okay, and the nasal breathing plays on. I think you all know that there are many studies. I think Gill, Wells, and other doctors they studied that they found that apoplexia must be diagnosed properly. And if it is an attention and memory related, we can label it. And if it is related to intellectual disability, not only intellectual disability, from other component, don't label it as an apoplexia. It may be other causes also. That's why clear diagnosis must be made. And in apoplexia, some researchers who given that nasal neurosis. So the term may be used at different places. And these obstruction of nasal breathing, when you rectify the problem in a children's and any people, and they found that these problems are solved and they can able to show the attention. That means that is the only remedy as of now. That is treating the better breathing. And here and nasal breathing plays an important role. For what? We all know that circadian rhythm, automatic rhythm is there in our sleep. Circadian rhythm means that on the cycle will be there. That's why when you do that mindfulness meditation, nowadays there are many applications are there. It will say that 1, 2, 3, 4, 5, 6, exhale. 1, 2, 3, 4. So this is a rhythmic breathing will be there when we sleep. When these rhythmic breathing is there, and we will get an adequate energy. And they found that many of us, we think that our heart rate, blood pressure is on high means it's not good symptom, sign. And if it is on less means it's around 50 to 70, that means the person is healthy. These automatic rhythm will be maintained only there is no obstruction in the breathing. Nasal area, the breathing is done properly in a systematic, then we can able to solve. So that is an important thing that will make the person to get an adequate energy the very next day. Okay, and here you can see. So these were some of the devices were used by people, and the obstruction will be there, and some extra muscles will be there, and then this obstruction can be. These devices will be inserted, and it will free flow of air will go directly to that. Here you can see this is the area. The free flow will be there. This obstruction will be overcome. And these aproxexia, as I said, aproxexia was a term previously known as an aproxexia. Right now, they are enabling it an sleep-related respiratory disorder. Okay, sleep-related respiratory disorder, TRAS, nothing but an aproxexia. When you search right now in different sources, aproxexia means recent studies we cannot find it is because it comes under the category called sleep-related respiratory disorder. That's why I said when I was trying to find answer for the question what is aproxexia, I couldn't find more inputs on that. But when I put sleep-related respiratory disorder, I can get more and more inputs. And here you can see what are the clinical conditions we can find out. If the person who is having that sleep-related respiratory disorder or aproxexia, what are the conditions we can find? One is an obstruction in hypoapnea. Apnea means there is no breathing at all. There is no sleep apnea. You may hear that of sleep apnea. That means there is no breathing. Sometimes they may be pronounced as on dead. That there are cases where and when they were again resume the breathing and they come to they are alive. And obstructive hypo means less. Hyper means high. So hypoapnea means less than that. Very, very meagerly you can notice that breathing will be happening in an individual. There is an own condition. Second one is increase the resistance in the airway. There is the flow of air breathing in the nostril area will be increased because there is a resistance other that we have to give the pressure. Not if there is no pressure, if there is no obstruction, you feel it will go. There is an pressure, the obstruction is there, and then we have to give more pressure, then only we can inhale. We have to give more inhale that way. And the third the condition is obstructive sleep apnea syndrome. And that condition also, we can say that the person having that sleep-related respiratory disorder, and this sleep-related respiratory disorder, earlier it was called as an aproxexia. And we can see what are the main causes. I think we were I'm saying that for another past 15 minutes, nasal obstruction, and the inability of breathing and inadequacy of oxygen in the brain is the main cause for aproxexia. And we know that there are many people who are not attentive in classes or generally in public places, in the family communications also. These because we inform that there is an obstruction breathing, or it may be an total obstruction, complete obstruction, or partial obstruction, or hypoventilation. They are not having that. When we were in a closed room and if we are not having that adequate oxygen, we feel suffocation, hypoventilation, less ventilation will be there and we feel more uncomfortable. So these were the causes. When you are not having that adequate areas in the room, that's why when you see that most of the houses, we are having that adequate windows. The airflow will be there, free flow will be there. We know that catharsis also, we need ventilation. We have to maintain. When you are having the better ventilation, key areas will be there, and there is no problem. The attention deficit will not come. The mechanical obstruction in our body, physical body, some parts will be enlarged. Enlarged. I think obesity is another cause for this kind of tonsils and adenoids were the reason for obstruction in the nasal area, and that lead to attention deficit. And these were also causes for apoplexia. And recently there were studies conducted in 2013 by Torres and Beltran. What they found, comorbidity. There is one symptom means there is another symptom also come along with that. So attention deficit means there is a respiratory problem during the sleep will be there. You have to check. The person is not attending in the class. You have to check with that. That's why when you see that when I was doing my education, whole education, teacher will say that if the student is not attending and he feel very sleepy, and teacher will say yesterday whether you had proper sleep or not. The first question will come from them. And based on that, they will determine that, okay, good sleep is necessary for attention. Okay, and this is caused because of that obstruction and other components, poor ventilation in the form. And the nasal attention deficit may be found in the nasal obstruction, can dramatically affect breathing during the sleep. Very true. When we are not having that adequate affect the breathing is not apoplexia. To cannot say that attention deficit directly or indirectly comorbid, go along with that sleeping disorder also. And it decreases when we are not having that adequate sleep, and it decreases our alertness when we are when we wake up from the bed, and we may not show that appropriate alertness when someone is calling you, may not show attention to that. There are many diagnostic strategies are there as another. One is on physician they can do, and that when the family members and the teachers can identify based on the symptom of this person is not showing attention, we can also get input from them also. And sometimes it is on when the person mostly not attentive, not showing answering the question means comorbid and sleep problem. We have to look into that. And as a person, when you decided to find out attention deficit is that whether the person have a sleep disorder or not. If it is so, then you can check with the respiratory component also. The only treatment is on these were the sources. And some of you may ask me, what are the sources you have gone through, and these were the sources. And you can check these 3 links. I will share with you. And one of the things, these 2 are PPT. These PPTs are very useful for you. It is around 4 to 5 pages. You can get more detail. As per my knowledge, apoplexia and now they are calling them sleep disorder, and breathing and sleep related is a comorbid. When the person having, they may not show adequate attention in the classroom. I think every day we are facing. If you have your children is not attentive, you have to look into that aspect also, or else we can go to that other surgery like the instruments. You can fix it and then ensure that breathing and ensure the sleeping pattern, and you can overcome these apoplexia. With that note, I can conclude my presentation. I record my sincere thanks to the organizers, especially the 4 team members, for giving the opportunity to come here and share my experiences. Thank you all, and thank you all for listening to me. Thank you so much.
Yes, thank you so much, Suresh Kumar sir, for coming up with a very wonderful topic, which is very new, and I'm sure most of the participants would have got benefited. And before I start the question and answer session, I want to give a few tips as a medical practitioner, because you have dealt about apoplexia, which is a very new term and a new terminology, and that deals with the obstruction of the nose, and as well as with the attention or with the lack of concentration. Sometimes we shouldn't overlook that kids do keep certain foreign bodies in their nose. They have this habit of placing papers or placing pencils or erasers, or because they being the kids, this is most of the cases, most of the ENT specialists will come across. So as soon as they have something with this, please don't tell that this is the terminology and your kid is suffering with apoplexia. Okay, so you just rule out the condition, then no come because sometimes we always get no carried away with the fancy names and all these things. So as a medical practitioner, I just want to tell every participant here, before we do any diagnosis or we come to conclusion, do the differential diagnosis, come out of all the possibilities, rule out, and you can come to the conclusion. And thank you so much for giving this opportunity for me to give my inputs. Thank you so much, sir. And participants, whoever have any questions, please do unmute your mic and go ahead, or you could put in the chat box so that I can facilitate the session. Sir, I have a question.
Yes.
Yes. Is there any evidence to show that kids who have been suffering with this, when they grow up, they have the problem of dementia? If they are not diagnosed in the early stages, are there any chances that there is any incidences of them affecting with dementia in their older age?
Now, one study I found recently in 2014 only, and I found there's a huge gap in that the particular topic, apoplexia. In after 1900, okay, 100 years there were no studies were recorded related to that, and no papers were presented. In 2014, one of the researchers, and there are three more researchers were also recorded, and what they found that they connect with that ADHD, okay, ADHD, hyperactivity, and apoplexia and sleep disorder, and they studied with the school children. And when they were discussing, they had an review of related literature, and they found that yes, there were among the many who were labeled as an attention deficit. Correct. Imagine that in a school, around 10 to 20 students are labeled as they are not attending in the classes. Imagine, giving a very meager number. So that students were analyzed, and they found that they grouped into not only there is only one component, attention deficit, ADHD, they grouped by the teachers based on their understanding. But when they were analyzing, they found that three sample they found that they had an apoplexia. There is an obstruction in that air, and that leads to poor sleep. And the next day they are not having the adequate energy for day-to-day daily activities, and they felt drowsiness, and it leaves an inability to pay attention to the class activities. There were studies recently done. And after 2014, I tried to find out anybody who has done a research on that. No one has done. But the term were used as a sleep disorder category. And now most of the people not giving that it is an attention deficit or attention disability or inability to pay attention. They giving that sleep disorder instead of nasal obstruction. They saying that sleep disorder category. They group these components. So that is my understanding from the sources I refer. I hope I given the answer for you.
Yes, sir. Thank you so much. Sir, any incidences, I mean, any affinity for sex, sir? I mean, like whether the incidence is more in girls or whether the incidence is more in boys. Is there any?
That is not, as I said, I couldn't find more studies on that. I think we have to take up few more studies. And if we come to know that if any of the schools they are come up with that, if they give a permission, definitely we can explore and jointly can find out who is having more affected in that. And I can say nowadays obesity is another important thing. Definitely, I can say the number may increase in coming days. Okay, extra body part when they were more in size, and there is definitely there is an obstruction will be there. I hope, and we have to be these problems will be re-emerged and be studied. As there is a link between reaching intellectual ability, can the right aroma increases attention also? Definitely, I agree with that. Practitioner, they put it, and few studies were found that when the aroma has an impact on attention span. Some aroma will distract us, some aroma will make an aggressive, some aroma will make you very peaceful. I agree with that, that will make. And I read somewhere that aroma rosemary oil helps memory too. That studies are going on, and that we can say that alternative strategy for increasing the memory or attention of an individual when there is no distraction in a place, and when you feel good and then you are having adequate energy, and there is no issue in showing that attention, and that's the thing. Yes, snoring is only because of obstruction in the nasal area. When you have the different musical tone from different people, and you can see that elderly, my father, my friends, and many people who are snoring, I can see that they will not, the rhyming will be there. So it is only because of obstruction, that obstruction leads this affect aproxia in the later stages. What is zoo effect? Yes, yes, definitely. Okay, so I think with that we can wind up. We can proceed.
Yes, sir. I think that's for that. I would really request Krishnan sir to explain what zoo effects mean. And also, I take this opportunity to call upon Krishnan sir to please place vote of thanks for our resource person. Krishnan sir? You're on mute, Suresh sir.
He is not there, Dr. Vinay.
Okay, okay.
I couldn't put his name in that list.
Ma'am, Salim sir, ma'am.
Okay, okay. So I call upon Dr. Salim sir to please place vote of thanks for today's speaker, our own Suresh sir.
Thank you, Veena ma'am, for giving the opportunity to give the vote of thanks, particularly for our head, Dr. Suresh sir. It's my pleasure to give the vote of thanks today. Sir, it is a wonderful session, sir. We had it about aproxia. I think there was a big gap in that 19th century. There is no research. I believe that today you give the insight about the gap. So hereafter, probably research scholars, probably they can do the research in topics, in these topics. So after this session, they might have even PDF level also. I believe that he can do it in your PDF.
Yes.
So it was a very good topic, sir. Even I believe that Veena ma'am raised the question about gender, the nasal obstruction, either the male or female. I can remember, if I am not wrong, remember that there is a septum deviation. It was more in males compared to females. Somewhere I'll read it. The septum deviation is the, again, nasal obstruction. It leads to the attention deficit. So it's compared to female, it's a male, they are having the more septum deviations currently. That's what some ENT specialists somewhere mentioned that one. So it was a very good session, sir. After John, Jacob, and William, and hi. So after that, probably you will be in the list in the 20th century. Maybe your PDF postdoctoral fellowship can do the aproxia.
We'll find out the funding agency, definitely will do that, sir. We have to wait up.
Of course, sir. Yeah, yeah. So it was a very good session, sir. Very good insight, and even you said there is no article, research article also.
Yes.
Probably we can do some papers also. We can write a paper about this aproxia.
Yes.
So thanks, sir. Thanks for the great insight, sir.
Thank you,
Thank
team.
you very much.
Thank you, participants. Thank you all. We'll meet again. Thank you so much. Have a nice day.
So I would like to thank you to all the participants on behalf of American College Madurai and MS Chalamuthi Institute of Rehabilitation Center and Madras School of Social Work. Department of Psychology, Madurai Kamarajar University, and Red Pond Educational and Psychological Research Center, and Psycho-Oncological Association, Turkey. Thank you to all the participants and our resource person, Dr. Suresh sir.
Yes. Thank you,
Thank
Dr. Salim sir. Thank you, Suresh sir. And participants, kindly send your queries and feedback to mywebinarfeedback@gmail.com. We will meet tomorrow with yet another wonderful session. Thank you. Good night. Bye-bye.